This presentation is focused on the special needs group of obese adolescents in the state of West Virginia. This presentation will also examine some of the factors that can potentially contribute to obesity in the state's adolescent population, as well as methods of prevention and health promotion. There will be a discussion of how ethical, cultural, spiritual, environmental, community, and home health play their role in conducting the advanced health assessment. The presentation will look at Florence Nightingale's environmental theory and how she says that altering an environment can change the status of a patient's health. There will also be a discussion on technology such as smart devices like phones, tablets, wireless health monitoring devices, and how they can be an educational tool for the healthcare provider, as well as potential health prevention and health promotion devices for the patient. A DIKW model will be presented that will combine data from studies about obesity in adolescents, Florence Nightingale's environmental theory, and the use of technology to assemble the framework needed for an advanced health assessment of the obese adolescent. The DIKW model will explain and show how all of these factors work together and complement each other when conducting an advanced health assessment of a special group. Obesity has increased dramatically in the past 3 decades among adolescents and is classified by the World Health Organization by the criteria of using the Body Mass Index, or BMI, which is an important screening tool. But it must be integrated with other information in the advanced health assessment, such as detailed medical history and physical examination. According to the West Virginia Medical Journal, West Virginia ranks second in the United States for obesity prevalence in children and adolescents, with 20.9% of children ages 10 to 17 years of age being obese. This is significantly higher than a national average of 14.8%. The obesity study that was conducted in West Virginia states obesity that begins before age 8 and persists into adulthood is associated with an average final BMI of 41, as compared to a BMI of 35 for adult onset obesity. First, let's talk about the DIKW model and how it supports evidence-based nursing practices when assessing the obese adolescents. According to Matney and Staggers, the DIKW framework is widely accepted by the international nursing informatics community as a foundational model for the field of nursing. When a health assessment is taken on the obese adolescent, data is gathered in the means of blood pressure, oxygen saturation, heart rate, body mass index or BMI, weight, height, age, lab results, just to name a few. The data is then entered into the facility's computer system, where it is now considered information. The data entered into the computer will alert the nurse if there are any abnormal values such as a high blood pressure, high blood glucose reading, abnormal lab values, and it will also let the nurse know if the BMI is considered underweight, normal, or overweight. After the nurse analyzes the information and notes any abnormalities, a plan can then be formulated to ensure the patient has a health prevention or health promotion plan that is optimal and specific for that individual. Being now aware of the abnormalities and understanding the condition of the patient is the knowledge part of the model. The nurse now has information combined with awareness and understanding of the patient's condition. This new knowledge is what will guide the nurse in formulating the best health care plan for the patient. The knowledge section of the model then transfers to the wisdom section. Susan Matney was quoted in an article saying that wisdom is the appropriate use of knowledge to manage and solve human problems. It is knowing when and how to apply knowledge to deal with complex problems or specific human needs. Although the nurse has data, information, and knowledge from the assessment, they must be able to utilize this information wisely. What good would this information and knowledge be if it were discarded and no action was taken? The nurse must wisely know when and how to apply the knowledge to effectively assist the patient to the best of their ability. The DIKW model can potentially be beneficial for the nurse as well as for the patient. The nurse can take the information and knowledge gained from the assessment, which then allows the nurse to educate the patient about their condition and construct the necessary plan that will potentially help the patient with health promotion and disease prevention. For example, the nurse can present things such as abnormal lab values and then educate the obese adolescent on things such as exercise and diet to lower cholesterol levels or avoiding sugary foods to lower blood glucose levels to potentially prevent diabetes and managing weight to cut down risks of developing coronary artery disease. The model can produce knowledge and wisdom that can then be turned into treatment and education to promote optimal health for the obese adolescent. Okay, I've showed you the basic DIKW model, but let's add some things to the model and see how it all intertwines and works together for the best possible outcome for the patient. The next thing that'll be discussed and added to the model will be Florence Nightingale's environmental theory. Florence Nightingale served as a nurse during the Crimean War where she tended to wounded soldiers. It was a battlefield like this one where Nightingale identified certain environmental factors such as fresh air, pure water, sufficient nutrition, cleanliness of the patient and the environment, as well as adequate sunlight, are needed to facilitate health in the patient. Nightingale's theory spoke about how the environment around us can be manipulated and used to promote healing and proper health. So by speaking with the obese adolescent, we can gain data about the type of home they live in. Do they have adequate food, proper heating, clean drinking water? And we want to look at cleanliness of the patient and the home to ensure the patient is breathing clean air. After gathering this data, the nurse can then start to plug things into our DIKW model. The nurse can analyze if there are any issues that may hinder the adolescent's health with such things such as unclean drinking water, not enough food or eating a lot of takeout food, seeing if the adolescent has heat and a bed to sleep in, and can then construct a plan to ensure the adolescent receives education and possible interventions and help if necessary. The DIKW presents us with data, information, and knowledge about the patient. But Nightingale's theory goes deeper in trying to ensure the patient has the proper environment in which to heal and thrive with their health. By analyzing Nightingale's theory and asking questions that pertain to the adolescent's environment, it can potentially help uncover other causes of illness and disease. Nightingale understood that the environment in which we live can help or hinder one's health. There are several other considerations to consider when conducting the advanced health assessment, such as the adolescent's ethical and cultural background, their spirituality, the environment and the community in which they live, and what type of home health needs they may have. These considerations can also be added to the DIKW model to gain knowledge and wisdom from the nurse's findings. As we mentioned before, the environment of the adolescent is important to assess so the nurse can see if the adolescent has the proper environment to grow and thrive with their health. An article by Albrecht and Catani said that the impact of children's environments, as well as their participation in everyday activities, play a large role on the child and adolescent's well-being. Going back to Nightingale's theory, the environment around the adolescent can potentially help or hurt the condition of their health. The nurse should assess the surroundings of the adolescent and identify anything that may be potentially harmful to their health or well-being, such as home without clean drinking water, or a home without heat, or even a home miles down a dirt road without electricity. The nurse should assess to see if it's a livable structure with proper bathroom facilities for the adolescent. These types of homes are seen throughout different parts of the state of West Virginia. The nurse should also make an ethical assessment of the adolescent, see what the adolescent knows, what they can do, and what they understand. According to an article by Foster and Ness, ethics are the moral principles in which adolescents behave in society, and ethics shape the way the adolescent lives, the things they do, as well as the world they create for themselves. This type of assessment could potentially let the nurse know if the obese adolescents from West Virginia have an understanding of things they should or should not be doing to decrease or prevent their chances of obesity, and the impacts obesity potentially could have on their lives. Moral and ethics tests can be given both orally and written to the adolescents to evaluate effectiveness and the degree of ethical and moral behavior. An article by Neese states that these tests give the adolescents scenarios where they answer questions about what they would do in given situations or circumstances, and the results are used to identify antecedents of ethical behavior, integrity, or accountability. The results would then be analyzed to see where the adolescent stands with their moral and ethical behaviors or beliefs. This can potentially be beneficial on the outcome or the cause of their current health status. If the results are unsatisfactory, then it may be necessary to interview the family to see where they stand with their ethical and moral behaviors and beliefs. The next thing is the cultural assessment. There are many cultures in West Virginia, so the nurse would want to assess and determine the adolescent's culture and the type of care that will need to be mapped out and individualized for each adolescent. When doing the advanced health assessment, the nurse should also speak with the parents of the adolescent to understand the culture and see what type of care they expect their child to receive. This assessment can be accomplished through interview or even a survey or questionnaire. It may be the family's culture consists of eating largely cooked, unhealthy meals daily, potentially contributing to the adolescent's obesity. It is also a possibility that some cultures may be exposed to stressors, such as trauma, violence, racism, or even economic difficulties, which could potentially reflect that stress onto the adolescent. Such stressors can potentially cause depression or withdrawal in the adolescent and keep them from enjoying outdoor activities, and may cause overeating due to the stress. Spirituality is another area that should be addressed when completing an advanced health assessment. In case of terminal illness or disease, some adolescents may take comfort in their spirituality or religion, so the nurse should take care and be aware of what their religion is and address it appropriately and professionally. According to an article by Kelly, May, and Marr, religion and spirituality are important to many Americans and influence the illness experience and receipt of medical care. Further, patients, nurses, and physicians believe that spiritual care positively influences the patient-practitioner relationship, with patients noting the greatest impact. Assessing and determining the child and adolescent's spiritual beliefs and situations, the nurse may be able to use this knowledge to provide a higher level of comfort and care. Spirituality can potentially give the children and adolescents a sense of comfort and a sense of security in their time of need, whether it be injury or illness. The state of West Virginia has many churches and many different religions, so knowing and understanding what religion they belong to will help the nurse in guiding this special group in receiving the appropriate spiritual advice when and if needed. This can also be assessed with interviews or surveys to figure out what brings the adolescent and the family peace and serenity. Community and home health needs should also be assessed by the nurse when conducting the advanced health assessment on adolescents. Weber defines community as a collection of people with a social structure, a group with a sense of belonging or having community spirit, and where all the daily activities of a community, work and non-work, take place within a certain self-contained geographical area. Knowing the community can alert the nurse to what resources are nearby and can evaluate how far the adolescent may be from local hospitals or physicians' offices. The nurse can also evaluate distances from food supplies, such as grocery stores or restaurants. Some families may be relatively close to fast food and consume it daily, potentially contributing to the obesity of the adolescent. The nurse can also assess the type of community to look at statistically and see if the area is high in crime, the amount of gun violence, poverty, drug abuse, or the different types of disease or illness that may be present within that community. The nurse also needs to assess the types of resources that may be available within the community to assist families in their time of need, emergency, or disaster. The nurse should assess what businesses or nonprofit groups provide aid, food, water, or shelter during an emergency. Another slice of the pie chart belongs to the assessment of home health needs for the adolescent. Home health needs begin with the nurse knowing where the home is and what kind of access there is to the home. The nurse needs to be familiar with the community and know what type of vehicle may be needed and if they will need assistance, as some homes sit on mountainsides. West Virginia has mountainous terrain, and some homes require four-wheel drive vehicles to gain access. Some families have limited or no access to heat, electricity, or properly running water, and the nurse needs to be prepared and equipped to deal with these situations should a problem arise, such as needing electricity for an oxygen machine or some other therapy or treatment device. The obese adolescent could potentially have sleep apnea or other difficulties breathing. The last part of the pie chart for our DIKW model will be technology and how it can be used by the nurse and by the patient and could potentially improve the adolescent's obesity or prevent it from ever occurring. Technology has many ways to educate as well as track the overall health history of the adolescent. Technology for the improvement of the adolescent's health can come in many forms and be used by many devices, stored, transferred, and used in real time or later. Technology that can be used by the nurse includes smartphones, tablets such as iPads, touchscreens, electronic health records, voice recognition and speak-to-text, digital ink for signing papers electronically, personal health records, patient portals, Wi-Fi, and GPS, just to name a few. The adolescent can also use this technology to watch educational videos about health promotion and learn other ways to stay healthy and prevent potential illness and disease. The adolescent should be shown how to use the devices, and a return demonstration would reinforce their ability to use it properly. The adolescent can be shown how to access certain websites that address obesity and ways to lose weight with diet and exercise. The nurse could also show the adolescent peer-reviewed articles and journals that will properly educate the adolescent about the risks of obesity, such as diabetes and cardiac disease. Ensuring the adolescent knows how to properly use the technology would potentially open a world of education about obesity that could potentially change the behavior and habits of the adolescent. When the nurse completes the advanced assessment, the results are usually stored in the facility's database for future reference. This can be used as a baseline of the adolescent's health and can be compared with each visit or checkup to determine if the adolescent's health is improving, staying the same, or getting worse. There is also wearable technology that allows the adolescent to have certain aspects of their health recorded for the physician in real time or saved to memory to be analyzed later. Such devices include smartwatches, which record a patient's heart rate, wireless glucometers that can save or transmit the results, vital sign machines that can wirelessly transmit information directly to the provider, wearable heart monitors and life vests that can detect heart abnormalities. An article by Bajwa states, new technologies will allow remote monitoring of patients and their access to health care, health data collection, patient identification, medicine administration, medication compliance, information exchange with the providers and other patients, access to medical record, amongst several other benefits that will continue to accrue with the fast-paced development of medical and allied health technologies. The use of technology is very beneficial for the special needs group because it allows the nurse or physician to examine recorded or real-time data and make an assessment and treatment plan to facilitate potentially better health outcomes. The data from the technology is what gives the nurse the appropriate information to determine what health plan or intervention is needed. For example, high blood pressure or high blood sugar would need appropriate intervention from a healthcare professional. This is where the DIKW model comes into play and helps the nurse analyze the situation and make knowledgeable decisions to improve the obese adolescent's health outcomes. The data from the tests, wireless devices, or wearable devices is entered into the computer where it is analyzed against normal values, and it is then transformed into information for the nurse. The nurse then takes, for example, abnormal values and determines a proper health plan of action to help remedy the obese adolescent's abnormal values. This plan, of course, needs implementation. It just can't be figured, analyzed, and developed and left to sit. It needs to be properly implemented, and this is where the nurse uses the knowledge part of the model. The nurse needs to take the appropriate health plan and know how and when to use it to optimize the health of the obese adolescent. Technology is great in that it allows us to take the adolescent's information that was gathered from all the data and stored in a computer database so that other nurses or healthcare professionals can see and learn what was done for the patient in the past. Researching what other healthcare professionals have done for the adolescent in the form of patient care and treatment gives nurses solid evidence-based practices and provides the healthcare professional with knowledge and potential wisdom to make sound judgments and decisions with current and future patient care. Here is a model that was taken from Matney that shows a basic DIKW model and the parts that make it up. So many things can be incorporated into this type of model to compare, analyze, and set basic framework with the advanced health assessment. Let's look at all the things discussed throughout this presentation and how they fit and work together in the DIKW model. Here is the model with all the elements discussed incorporated. As pictured, the data, information, knowledge, and wisdom are at the center of the model. All the other sections should supply the necessary data for the model to work properly. All these sections pull together to give the nurse the appropriate information to make knowledgeable and wise decisions to aid the adolescent in obesity prevention or educational ways for health promotion and to provide ways to remedy their condition. While researching the special needs group of obese adolescents, I started to think of potential challenges I could be faced with when conducting my assessment. I started thinking about ways I would approach the adolescent and what I might say to make them feel comfortable and gain their trust. Adolescents may be embarrassed of their obesity, and gaining their trust may potentially produce better subjective data. The facts are that according to a study conducted by the West Virginia Medical Journal, West Virginia ranks second in the nation for adolescent obesity. Another fact the article discussed was if obesity occurs before the age of 8 years old and persists into adulthood, it is associated with an average BMI of 41 as compared to a BMI of 35 for adult onset obesity. I see adolescent obesity in West Virginia as a serious problematic area that needs to be addressed. I thought about the importance of adolescents having regular checkups to identify potential illness or disease, and I thought about how I would address how important this was to the adolescents and their parents or caregivers. What could I do as a healthcare professional to educate parents and adolescents on the importance of regular checkups to ensure they came back as directed? One of my main focus areas during the assessment will be towards making the adolescent feel comfortable. I would want to build rapport so the adolescent would not feel like they were being judged because of their weight. I would encourage them to talk about the foods they eat and what types of activities they like. Studies have suggested that adolescents are less accurate reporters of their dietary intake compared to young children and adults due to less structured eating habits, a relatively large proportion of meals consumed outside of the home, or just lack of motivation to log what they eat. I feel that if I can gain the adolescent's trust and give them a non-judgmental, trustworthy environment, that they may be more apt to want to come back for their routine checkups. I don't feel as if it's enough to just care about their health. I want to show each individual adolescent that I care by spending the needed time to educate, by being honest, by listening, and providing them with the necessary tools for optimal health promotion. An article by Kim and White said, as healthcare providers, communication practices play a vital role in terms of early identification of concerns, emotional support, implementation of preventative measures, effective illness management, and health education. When contemplating ways to assist the adolescent as a nurse, I would begin by asking the adolescent to keep a food diary where they input the food and drinks they have throughout the day for a set number of days or weeks. I would then suggest the adolescent use a food tracking app that would help the adolescent keep track of their daily food and drink. I would have an app on hand that I could demonstrate to the adolescent so they could observe how the application worked and to answer any questions that they may have. That data can then be evaluated and then analyzed and turned into information and knowledge by distinguishing which foods and drinks are bad or good for the adolescent. Then I would sit down with the adolescent and discuss what foods are healthy and which ones are not. The same thing can be implemented with exercise. I could then show the adolescent one of many applications that could be installed on a smartphone, tablet, computer, or smartwatch to track their daily exercise. That data can also be evaluated and analyzed from the technology to inform the adolescent if they are receiving an adequate amount of daily exercise. I would then use that data to help the adolescent formulate a healthy and appropriate exercise plan if necessary. According to an article by Stevenson, motivation was found to be an important facilitator, and intrinsically motivated participants used the dietary and exercise applications because they found it fun to use. The challenge of not seeing the healthcare professional regularly can also be managed with technology. If necessary, I could then teach the adolescent and the parents how to use digital blood pressure machines, which measure the blood pressure as well as heart rate, and most have an extensive memory to store multiple entries that can be evaluated, recorded, and reported to the healthcare professional. Next, the adolescent can be taught and shown the use of home glucometers if the current situation of the adolescent requires. Most glucometers also have an extensive memory for storing multiple blood sugars that can be analyzed and addressed if necessary. If needed, the adolescent could receive home health visits that, when the home health nurse enters the information from the visit, would potentially be transmitted back to the treating healthcare professional for immediate review. With this method, that could possibly open the idea of the adolescent and parent using and accessing a patient portal. The patient portals are healthcare-related online applications that allow patients to interact and communicate with their healthcare providers anytime from anywhere, and would allow the adolescent or parent to access their medical information and interact with providers through the internet. All these technological tools allow the nurse or other healthcare professional to review data and make sound decisions to address possible issues the obese adolescent may be facing or dealing with. If I had this project to do over again, I would focus more on education, and possibly developing my own educational plan tailored for adolescents on obesity prevention and health promotion. I would want to design a plan that was simple, educational, and was structured in a way that the adolescent would have fun or enjoy using. I would also do more extensive research on the effects that obesity has on the adolescent's overall physical and mental health. There are many aspects of the advanced health assessment, and some areas seem at times as if they do not get the full attention of other areas, such as the ethical background, their culture, spirituality, and home health assessment needs. These areas are what dictates to the healthcare professional the types of care the adolescent expects based on their culture or religion, or what makes the patient feel calm, and what they turn to in times of need based also on their spirituality or religion. The special needs group can be assessed, analyzed, and evaluated in the office and given specific instructions, but the healthcare professional needs to ensure that the home health needs are met so that they can comply with the treatment plan prescribed for them. Knowing the adolescent's culture, the language they speak, how they feel about medication or treatments, can potentially affect the adolescent's experience that is related to the care of their health and may potentially influence the adolescent to be more compliant with their treatment plans. The nurse wants to understand where the adolescent stands with their spirituality. Spirituality can potentially give the adolescent a form of peace, hope, and positive thinking when it comes to improving their health, and showing an interest in the adolescent's spiritual beliefs could potentially strengthen trust between healthcare professional and the adolescent. Understand the adolescent's religion and if they have beliefs, rituals, or ceremonies that they may practice in public or private. Give them the necessary time and space to perform such rituals. Also, some religions have specific diets, so it's important for the nurse to get involved and see what the adolescent may or may not be able to eat at mealtimes. Sometimes the adolescent may turn to their religion if they are depressed or have anxiety for comfort which they may be experiencing from being obese. Understanding their religion and helping them focus on comfort and decreasing anxiety or depression could help lessen disease or illness such as hypertension. Knowing the adolescent's culture, spirituality, religion, and home health needs, and respecting these areas and acting professionally can potentially build trust and make the patient more comfortable, therefore promoting optimal health.